pandemic is not over, and there is a tremendous infection and death as a result of it. Um, Stay at home unless you have to go out. If you have to go out, then wear a mask, keep your social distance, and wash your hands constantly. That, along with the vaccine, as it becomes more available and more people take it, then according to the medical people, the combination of this prevention and the vaccination will result in us having a situation where we can begin to return to normal. So I'll turn it over to Director Kimball, who will give you an update as to where we are now and then where we will be going, the direction we'll be taking going forward, and then we'll answer your questions. Director.
Good afternoon. What I'll do is give an update as what we've done thus far and talk a little bit about where we're going as we go forward. The city has received approximately or exactly 6,500 doses of Moderna vaccine to vaccinate 1A, phase 1A eligible individuals. To date, we've vaccinated 1,767 individuals. During our phase one, we initiated our phase one plan on December 24th. The individuals or the groups of phase one that we focused on with our healthcare workers, our long-term care facility residents and staff. This includes our EMS workers and our EMTs from fire. Between December 24th and December 29th, we vaccinated a total of 660 individuals that fell into phase one. And this included our EMTs and EMS workers. Last week, the city reopened our pod at Public Auditorium to vaccinate additional phase one eligible individuals. This included our partners from our federal qualified health centers, our FHQCs, and other healthcare providers, including medical students that are providing direct care and additional city EMTs or paramedics. An additional 1,107 were vaccinated last week. The city will continue to provide vaccine to healthcare providers at Public Auditorium. However, in addition, the city will also initiate plans to vaccine individuals that reside in congregate living facilities. As part of our efforts, the city also activated a mobile pod that will be sent out to congregate living spaces, facilities to vaccinate individuals that have mobile challenges. We approximate 280 congregate living facilities within our city boundaries. This equates to approximately over 2,600 individuals that we will be providing vaccine to. Last week, we conducted a proof of concept test for our mobile pod unit. This was successful, and we were able to vaccinate 130 individuals in 2 different congregate living facilities. We will continue to utilize mobile pods to vaccinate those individuals who are homebound or who have mobile challenges. Over the next few weeks, the city will continue to provide initial vaccines to phase one individuals. Beginning January 21st, the city will also begin to provide the second dose to those individuals in phase one who received their vaccine. As we move forward, our next steps, the city is currently taking the necessary steps to prepare vaccine to phase one into phase B individuals. Now, phase B individuals, based on the definition from the state, based on the guidelines we received from the state, include those 65 and over, people with severe developmental or early onset medical disorders, that make them particularly vulnerable. In addition, we will be focusing on employees in K through 12 districts or schools that plan to return to full in-person or a hybrid instruction model. Over the next few days, we will make available our detailed plans regarding our phase 1B rollout to begin to administer to that population. Okay. Yeah.
Now, the figures that the director gave you are just the figures associated with who we have given vaccinations to and the categories that we're responsible for. It does not take into consideration what is happening at the hospitals or with Walgreens or CVX. They also have figures that they have, and in the 280 congregate living facilities, the 2,600 we anticipate residents and employees from there are those that were either not signed up with the pharmacies or were of a different category, but we become responsible for. So we're working again with EMS, fire, the EMTs, the paramedics, the congregate living as the director, and then we're planning on, as the governor expands the group from the 65 and older, and also for school employees so that we can get the schools open, we will handle those portions of those populations that will come to us, and there will be hospitals and other clinics and others, and Walgreens and CVX who will handle a portion of them also. So we're open for questions now.
Okay, Mayor. The first question is from Ed Gallick from Fox 8. He has a few of them. His first question is, why won't you answer verbal questions, and why only take questions in writing filtered through your staff?
Well, this is my first question. First question to me was, why won't I take questions in person? And why am I just taking them in writing and through my staff? It's because that's the process right now. We're in the middle of a pandemic, and not only that, I find this to be a better dissemination of information, because everyone listens and hears the same thing, and there's no filter or no portrayal of whatever I've said one way or another. If I've just said it, and you can use whatever I say in the context in which I've said it. And then thirdly, that there are people on this that are not just media, but they're just the general public. And I find that the general public is looking for a lot of information, and they're looking for it in its proper context and having it accurate. So I will continue this, and hopefully when we get back to normal, you will have your opportunity to interview me in person.
His next question is, why has the city of Cleveland rollout of the COVID-19 vaccine been so slow while the virus continues to rage?
Same reporter. Why is the city of Cleveland's rollout of the vaccine has been so slow while the virus continues to rage? Well, I imagine that's the same question they're asking all over this country as to, first of all, the availability of the vaccine, the availability of it. Is there enough available to meet the demand? And the answer is no. And secondly, as I mentioned early on, there's no infrastructure for this. There are pronouncements made at the federal and the state level as to what should be done. And then it's left up to local communities to build an infrastructure to do that and to get it done and do it right. And our intent is to do it and do it right. And as we build out this infrastructure and increase our capacity, we'll be able to do it and do it right and be more efficient about it and be more effective with it.
Last question from Ed Gallick. Why has the city's health department stumbled throughout the pandemic from failures investigating complaints, failing to fill open positions, and failing to get the vaccine out quickly?
Well, same reporter. Why has the health department failed in this pandemic in terms of what?
Investigating
Complaints,
filling open positions,
and
failing to get the vaccine out
and
quickly.
failing to get the vaccine. I think I answered the third one about getting the vaccine out quickly. But first of all, let me, and again, this is why this format is so good. You use the word failing, which is completely inaccurate and it has connotation to it. We have done our job with the resources and the personnel that we have, and that those, and we are bringing on people, and we're contracting out for services. We're setting up an infrastructure for the dispensing of the vaccine. We set up for the tracking mechanism. We set up ways in which to deal with complaints when people are complaining about an establishment not functioning in a way according to the federal guidelines or the state or even our city guidelines. So we have all those things. We're moving, and we're moving on all those areas at the same time. So your connotation and description of failure is inaccurate and a misrepresentation.
Okay, next question. There are a couple of them from Kevin Berry from News 5.
Mm-hmm.
How many total eligible EMS, fire, airport fire department, and POD support staff are there?
So the question is how many EMS, fire, airport, and support staff are there? Do you have a number on that? What is that number?
So it's 1,045.
Come on.
So there are 1,045 EMT and paramedics.
Okay. Mayor, the next question.
And on the supports side of that, as we build out the infrastructure, the support staff may not be paramedics or EMTs or firefighters or things like that. And that's why in this first phase, we're also giving the vaccines to nursing students who are participating in direct services to people. And then we have staff of internal staff with the city and who are also in contact with people in this infrastructure of dispensing the vaccine. So they become, and that number, we just don't know yet. We just don't know what that number is, but that is a significant number also. And the more pods we set up, then the more citizens we will have, or in city employees or non-city employees we will have to help support that pod to dispense the vaccine, so they will become eligible too. But we don't have a definite figure on that one, but it is a pretty good number.
Next question, also from Kevin Berry from News 5. What role will Cleveland play in vaccinating the general public?
The role, great question. What role? Because, this question is the question. It is the question. What role will we as a city have in vaccinating the general public? That is what we're struggling with all the time in terms of our contact, our health department contacting the state health department, the mayors, not just Cleveland mayor, but mayors in the major urban centers throughout the state. The conversation that we have with the governor and the lieutenant governor. Just had a conversation today, and that was the crust of the conversation. As the Trump administration and President-elect Biden administration are now in agreement on something about just not holding back on vaccine and just letting the vaccines come out. The question is, what will that mean? What will that mean in terms of the amount of vaccines that are coming? And then secondly, what does that mean in terms of us having an infrastructure to receive it and then to vaccinate people? And so then thirdly on that, then out of the general public, then what category of that general public are we responsible for? Just like when the director talked about 1A, he talked about EMS and fire and then the congregate living. Well, that was our responsibility. We focused on that. But as things get bigger and they open it up to 65 and over, then the question becomes, what is our capacity and what is our infrastructure to vaccinate that population? And we're not going to be the only ones doing it. CVX will be doing it. Walgreens, other pharmacies, probably the federally qualified health clinics, Metro, Cleveland Clinic, University Hospital. So it's the building of that collaborative infrastructure so that people have multiple places to go in order to receive the vaccine. And that's the real rub right now. And that has not been completely built out. Has not been completely built, but our role would be participating in that collaboration, in that organization that will get, and as we set up pods, not just in Public Hall, but in other parts of the city, and as people become eligible, then it will be our responsibility as they come there to be able to dispense the vaccine, but we will not be the only ones. It will be also the hospitals, the clinics, the pharmacies, and things like that. And the question is, what is that? How is that working? How do people get a clear understanding of what their choices are and where they should go? What's the most convenient for them? And that's exactly what we're working on right now. And that will be the real crust as the volume, as demand for the vaccine is higher than the supply of it. As the supply catches up with that demand, the question that you ask is really the crust of how does it get out, and then what role does the various entities have in getting it out in an efficient and effective way.
Okay, I'm going to combine the last question from Kevin Berry. How will the city verify that people who claim to be a certain age or have a qualifying medical condition actually have those conditions?
Well, another good question. How will the city, and I imagine just not the city, it would probably be all these other ones, other organizations who will be dispensing the virus in this next phase. How will the city and I guess others determine who is the right age and what are the qualifications to determine if in fact they have some underlying illness that makes them eligible? Again, that is being developed as we speak now. One of the things that we're completely aware of is if it's say for instance they say 65 and above, but they break it down. They say we want you to do 80 and above first, and 75 and above, then you go down to 60. That kind of thing. Well, then the question becomes, what if somebody, if it's 80 and above, and somebody comes there 79 years old, what are you going to do? Turn them away? And so we're looking at that particular thing as to not only the verification of it, but really the practicality of how do you verify things, but really the sensitivity of how do you turn people away when they are really eligible, they're just not eligible right now. When we have enough vaccine, where enough vaccine can meet the demand, then that does not become an issue, because if you come, you get it. But as give you an example, if we're going to receive, let's say, for instance, let's say 80 and above, yeah, I don't know how many 80 and above citizens there are in the city of Cleveland, but they're living in private homes, they're homeowners, they're renters in private property, they're living in public housing, and they're living in senior high rises, both public housing and non. I don't know how many of that is, but I would venture to say that's thousands, many more people than we have vaccine for. And so the question becomes, how do you tell somebody no when they are really eligible because you don't have enough vaccine? That's the issue. When the vaccine reaches the demand, then that issue goes away. So we are trying to figure out how we're going to do that and get some verification as they narrow the category. How do we verify you're in this narrow category? And on the underlying illness, I don't know. I imagine the CDC will set some guidelines, and those guidelines will go to the state, and the state will either follow them word for word, or they'll develop some tweak to those, and then we'll have to follow whatever they send down. I hope that answers your question.
And Mr. Berry's last question is, where will residents be able to get the vaccination?
And that, again, that goes back to your first question, it's the same report as back to your first question, which is the real issue, is what is the infrastructure locally? And I'm not, I'm Cleveland, so we're talking about Cleveland, but this is existing everywhere. What is the infrastructure locally so that people have a choice? They can make that choice as to where they want to go and have that choice that is most convenient for them. And so we intend, we're going to have public halls set up, continue in its operation. We're going to create, we have one mobile unit. We're going to try to create at least a couple of more mobile units to get to people who may not be able to get out, or is not is convenient for the inconvenient for them to go somewhere. We're looking at setting up additional vaccination pods all over the city, in various parts of the city, so that we can people will be convenient for people to get there. So we're building that infrastructure as we go.
Okay, Mayor, moving on. Joan from Cleveland asked, are child care workers included in phase 1B along with employees that are at K-12 schools?
Do you know that answer? The question is, are child care workers included in 1B that would be similar to them designating people who work in schools as eligible category now? So they want to know if child care workers will be eligible along with that.
So, child care workers, while identified in the CDC's description of phase 1B, is included into that group. However, we are operating or under the guidance of the Ohio Department of Health. Our priority for 1B currently remains 65 and above, and those adults that are working in K through 12 school and school districts. So at this time, they're not in the priority for 1B. However, as more guidance or information comes out from the state, we will be informing you of when your turn or the turn is for those individuals that are working in childcare.
Now, this is a perfect example of how they set these categories, and then they say on a local area, you figure out how to do it, and then we want you to limit it and prioritize it. And that's because they have this huge demand, and even in their category, a large number of eligible people, but they don't have anywhere near the sufficient amount of vaccine in order to cover that category. So they're phasing it and they're prioritizing it, which creates a lot of confusion, and it creates a lot of anxiety in people, because what they know is that, look, I'm the same as this person. I'm just maybe doing it in a different area, in a different way, but I fall in that category too. Why can't I have it? And that's a perfect question, and it's a legitimate question. The answer is that because they don't have the vaccine. That's what they would tell us. And then they would also tell us that if you have somebody who may be in that 1B, you can only dispense the vaccine to the prioritization, even though that person's in that 1B. And that becomes a very difficult challenge for the people who are working the pods. It's like the reporter asked a question around the verification of age. You know, so in 6 months, I'll be 80. What do you do? So it creates a dynamic out there that is not a good dynamic, because people will feel and believe that they're being treated unfairly because they are in this broader group, but they're not in a prioritized group. And then they leave it up to local communities to dispense, and we only can dispense based on the amount of vaccines we get. And then we will, again, as this ramps up, and hopefully as Trump and the Biden administration have agreed on letting more vaccine come and not holding it back, then what they can do, they can handle more people within the eligible category and not have to prioritize it, because we'll have sufficient amount of vaccine to do it. Now, this is just not going to be for the city of Cleveland. It's going to be for the hospitals. It's going to be for the federally qualified health clinics. It's going to be for the pharmacies at CVX or Walgreens or whoever else it may be. Whoever becomes, or whoever has the authority and ability to dispense the vaccine will have the same challenges that you are raising now.
Sue Chris asks, can Cleveland residents take part in the Cuyahoga County Board of Health notification of vaccine that is on their website?
The question is, can the citizens of the city of Cleveland take part in the county's, what is it, notice of what?
Notification of vaccines being available.
Notification of vaccine being available on the county's website. I don't know, be perfectly honest with you. And I don't know, I'm not fully understanding your question either. Are you talking about registering to get the vaccine? So I imagine if that's what the case is, if that's what you're asking, the city of Cleveland does exist in the county. And so if you're a resident of the county, it would seem to me you should be able to access the vaccine if it's available, and if you follow the rules of registering. I don't know that to be so, but I would assume that. The only reason why I would think the county would say go to Cleveland is because we have our own health department. Many cities don't have their own health department. It's county. But we, city of Cleveland, have a health department. So we handle this people of the city of Cleveland. And maybe the county will interpret that to mean that they handle everybody else. I'm not aware of that, but we'll find out. And see if we can clarify that, to see if someone, even though you live in the city of Cleveland, but the vaccine is available in a county distribution of the vaccine, are you able to go to that location even though you live in the city of Cleveland? I think that's what you're asking. Yes, or the director has the answer. I'm wondering, he got the answer.
So residents for the city of Cleveland, we're receiving vaccines for them. The county will receive vaccines for that population outside the city of Cleveland. They do have a registration portal on their website, and it's active. But if you live in the city of Cleveland, you would contact the Cleveland Department of Public Health to get more information as how to register when your phase group is available or eligible to receive vaccine.
The next question is from Brian Duffy from WOIO. Is the city finding that there are some people reluctant to take the vaccine? And that was a finding that Terry Allen of the county passed along.
Yes, I think in the general population, whether they're, I think the original question from the report from Channel 5 about the total number of EMS and firefighters, and then I guess the follow-up with that would be how many actually took it. And what we're finding is that everyone who is eligible is not taking it. And that is not only in terms of public sector employees, it's also happening at the hospitals, it's happening at the clinics, it's happening at the congregate living. The patients or the residents at the congregate living, is my understanding, have a higher rate of taking it. But when you get to the employees, you have fewer of them who are willing to take it. And I imagine as we begin to look at vaccinating school employees, whether they're janitors or clerical workers or teachers or police officers over at the school system, that you have the same dynamic there. So across the board, in both the public and private sector, we're finding that that people are rejecting the opportunity to take the vaccine. And in some areas is a higher rejection than other, I would imagine. But there are people who are not taking the vaccine by their choice.
Okay, Mayor, next we have several questions from Mark Namick from Channel 3. His first question, is the city keeping track of the number of city employees who refuse the vaccine? And if not, why?
What we do is this. The question is, are we keeping track of the number of city employees who don't accept the vaccine? And if we're not, why? What we keep track of is the ones who take it. And that just automatically leaves it very glaring as who didn't take it. But we'll know who took it. We're not just got a checklist say you didn't take it, you didn't take it, because we are keeping records of those who have taken it, because we have to report that to the state. And then that person who has taken it has, depending on which vaccine, I think ours is a 4-week or 3-week.
28 days.
28 days for ours. They have to come back and get it again. So we want to know if they came back the second time. So by process of elimination, we would know who hasn't taken it, but we're keeping track of who has taken it.
His next question, again, Mark Namick from Channel 3. Data is considered the key to distribution and understanding the virus. What are you doing to convince folks to take it?
The question is, data, I don't know how this relates to each other, but I'll answer it. Data is the key to keeping track. So what am I doing to encourage people to take the vaccine? Well, I'm doing this. I do town hall meetings. I do public service announcements. We do a lot of stuff. And when my term comes, I'll take the vaccine. So, you know, there are people who just believe, for whatever reason, that this vaccine is unsafe. Then there's another group of people who say, well, I don't know, I'm gonna wait and see what happens to you. And if you don't get, if nothing happens to you, then I'll take it when my time, but I'm gonna wait till later so I can see how this thing plays out. So you have those two categories of people, the ones who are not taking it. Something wrong with this, it's a conspiracy, we shouldn't be doing this, all this anti-vaccination, no matter what it is, that kind is over there. And then you have another group of people, which I think is the larger group, who just are not convinced yet that things are okay, and they just want to see how things are going to turn out. And if they see people not getting sick, not having long-term or bad side effects, then that group will come around and they'll wind up taking it. They just are cautious, and they don't want to be first. We'll just see what happens to you, and then we'll go. Now the ones who are most likely to take it are the ones who are older, are the ones in the dying category. Because for them, they'll take the risk and say, I'll take it, particularly if I'm the most at risk in terms of dying from this thing. So yeah, I'll take it. That group is the easiest one to deal with.
Okay, next question from Mark Namick.
Mhm.
Do you have a list right now of employees in every department who might be eligible soon, and how are you preparing to get them shots?
Do I have a list of employees right now, not tomorrow, but right now, of employees who will be eligible, either eligible now or soon? And how will I do? What we do is we let people know when is their eligibility. I don't have a list. We have close to 8,000 employees or more, and I don't have a list. And there are people who are eligible. And we notify those people who are eligible. And when their time comes, we say to them that you are eligible, and we schedule them. Those who are willing, they are scheduled to go to the vaccination site to get their vaccination. And then that's it. So no, I don't have a list. I'm not creating a list. There's eligibility, and believe me, people are following this close enough to know when they're eligible, because they actually ask, am I next? And we tell them whatever the information we have. And when people become eligible, then they get scheduled. They go, right now, we're just using public hall for that. And they go to public hall to get the shots.
Okay. Another question from Mark Namick. You have said that you are building this from the ground up.
Mm-hmm.
So how are you considering other frontline workers, like those in housing, building and housing, whose inspectors have a lot of contact with the public?
The question is a very good question, because it's the underlining question of your other question, which is how are we looking at frontline people who are in contact with the public? How are we looking in terms of getting them scheduled for vaccine? If I had my way, then I would probably make them on a priority list in terms of frontline workers. And that's not just public safety, not just police, fire, and EMS. There's also waste collectors. There's building and housing, as you mentioned, and meter readers, the people who are the customer service people who deal with people who come to the various buildings, the receptionists, the security people, all those kind of things. That is a group of people who are coming in contact and really are working 5 days a week, 8 hours a day, and most of them, but they are not in the categories that we have described, and neither, and not only aren't they in a priority, they're not even a category right now. If I'm not mistaken, they're not even in a category. So there's no category for them. And this is a big debate going on, as particularly with frontline people who are at risk in terms of, because they come in contact every day and they're on a regular work schedule, and it's a discussion nationally and on the state level as to why aren't they included in this. And that goes back to, if you remember, in the private sector, the frontline workers who were the cashiers at a grocery store, or the Walmart, or Walgreens, or the frontline workers who was doing the stocking, that because they come in contact with people all the time. And I know that originally there was a conversation about putting them as part, excuse me, part of the priority in terms of as they were setting the priority, but they fell off the list. And when they fall off the list, then they pass the directions down to local community. And again, having that would be a very simple and easy function for us as the city of Cleveland. And I imagine it would be a very easy and simple function for any organization to identify those frontline workers and then to schedule them for a vaccine and have it, because they work for us, so we have better control over them. And we could just schedule them. So, okay, you be here at this time and you will receive your vaccine, and it would be done. But they're not eligible at this point because they fell off the eligibility, and so they're not even prioritized, they're not even eligible.
Next question from Name. Who is your office working with from the state or county? And specifically, who are you in contact with on a day-to-day basis regarding the vaccine distribution?
Who is my office in contact with, and who specifically am I in contact with? Well, the health department, I think on a daily basis, is in contact with state health department. I at least 2 times, and early on in the pandemic, 5 times a week was having conversation with other mayors and the governor and the lieutenant governor. And as we began to talk about this lately, it's been about 2 or 3 times a week. So the actual people who do work, they're pretty much in contact with each other in some form or fashion on a daily basis. And those like me who don't necessarily do the work, but we're in charge, we have discussions on a weekly basis. Right now, that's 2 to 3 times a week.
Okay. Next question from Mark Namick. Federal and state governments have been criticized for not getting enough shots out. They have used the same excuse as the city, that it's complicated and they have to build an infrastructure. So do you feel criticism is fair of the federal government and state? And why should the city not be criticized for only having distributed about 20% of your allotted vaccine?
Well, the question is, since the state and federal government has been criticized and they say it's complicated, so if we're saying the same thing, then why can't we be criticized? You can do what you want. My job is to make this work effectively and efficiently, and we're not. The reality is what it is. It's not that complicated. If you have a demand that's here and a supply to meet that demand that is here, then you're going to have to set up a way in which to distribute the supply until you reach a point where your supply and your demand are matched, or your supply is greater than your demand. That's just the way it is, and that's not complicated. That's just a reality, and that is not an excuse for the federal government or the state government or even local government. It's a fact. It's just the way it is, and there needs to be criticism of it. There's criticism of it because it's failed. It's failed from the top on down. And so it's not as if at the federal level that they didn't know this vaccine was coming. As a matter of fact, some people boasted that it would be here before the end of the year, and it came at the end of the year. But just saying something without putting the infrastructure in place to accommodate it is a whole different factor. And so now you have the responsibility of developing that infrastructure being put on local communities and on the state to develop policy on the dispensing and the distribution of vaccine when there is not enough vaccine to meet the demand. So I don't think, criticism is there. It's a failed operation from top to bottom. and that's why we're in the shape we're in now. That's why we have thousands of people dying now. That's why we have hundreds of thousands of people, what, 1 million people getting affected on a daily basis sometimes. So, so where do you blame? Who doesn't share blame when in fact people are dying every day? But what we do, we are doing our job, and that's why I try not to get sidetracked by the BS of this in terms of the drama associated with it. And I try to stay on my game and stay on point of creating an infrastructure that is the most efficient and effective to deal with the reality we have now of higher demand than we have supply. And then to build that infrastructure so that when the supply either meets or exceeds the demand, and then we'll have the ability to get it out in a massive way, along with our partners, whether they be hospitals, whether they be pharmacies, whether they be qualified health clinics, all those kind of things. So, it is what it is, as I always say. But I will tell you this. Let me explain that for a minute. Usually people think when I say it is what it is, that what I mean by that, nothing you can do about it. Those of you who think that just have a misunderstanding. When I say it is what it is, it means I have to deal with reality, no matter how painful it is. Because if I'm going to affect that reality and change that reality for the betterment of the people, I can't be living in an illusion as to what it should be and have a conversation, a dissertation on what it should be. It is not that. It is what it is. It is this. This is reality. And in order for me to change that reality and make that reality better for people in terms of outcome, I have to accept it, no matter how painful it is, or what criticism comes from, or what judgment comes from. And that's what we do.
Sid Stantler asked, I understand photographs are not being allowed in the vaccine distribution center on Lakeside. Would the city consider lifting that restriction so people can share pictures of themselves getting vaccinated to help convince others?
Well, they said there's a restriction on taking pictures in the facility where people getting vaccinated. And would we consider lifting that restriction so people can share pictures of them taking a vaccine, I imagine. The answer is no.
Dan DeRusse from WOIO asked, if the city has 6,500 doses, why have only 1,767 shots been given? Why not get it out into the arms that need it?
Again, the question is, since we have 6,500 doses, but we've only vaccinated 1,700 and something people, why don't we just get it out into the arms of people who need it? I believe I've answered that question several times in terms of if it was just open to the public and people could come in and get vaccinated, then we wouldn't have any vaccine. We would have none whatsoever. And then we'd still have a long line of people waiting, pretty upset the fact that the vaccine ran out and they were next in line. So that's not what's happening. What is happening is, based on CDC and state guidelines, they have prioritized categories, and they have prioritized groups within categories. And they want us to dispense it in that fashion. And we're doing that. And when we do that, then we have to get the people there, and we're doing it in a very systematic way. Now, the 1,700, by the end of the day, we'll probably have that total of 1,700, some will probably be over 2,000. Well, pretty soon, I think, next week, next couple of weeks, next week, we'll have to give out the second shot to people, the second vaccine to people. And so there will be people coming in who got the vaccine the first time who will come back and get the next vaccine. Now, we're anticipating that we'll get a shipment in to accommodate that second vaccine. But if we don't, we're going to have to use what we do have. So this is, you know, I would love to have enough to just give it to everybody, but that's not the case. And so in that sense, we have to be very strategic about how we do this, and to make sure that we're following the guidelines and getting it to people who want it, who are in the category and the priority of those category who want it. And that is what we're doing. We're doing it, I say today will be 200 to 300, probably more people will be vaccinated, a couple of hundred probably.
Sid Stadler, who is a freelance reporter, given that the vaccine has been in development since March, when did the city begin planning its vaccine rollout?
Said since the vaccine, the conversation of developing vaccines since March, since the pandemic began, there was a conversation of developing a vaccine. So since it was, we knew there was going to be a vaccine come, I'm paraphrasing, when did we begin to start our developing of our infrastructure? Or I guess the question is, could we have developed something sooner? Let me point out that we have had discussions about that. But at the same time, as the first reporter began to ask questions around what was going on then, we were hit with the pandemic and had to develop the infrastructure to deal with communication to people, the whole prevention side, the wearing of masks, social distancing, the proclamation of that we put in place, the mandate masks, dealing with this closing down of establishments, then reopening the establishments, and at the same time figuring out how are we going to provide economic assistance to small businesses and rental assistance to people who couldn't pay their rent, and then food service for people who didn't have food, and homeless service for people who were out on the street to make sure that they weren't left vulnerable. So that's what we were doing back then. And the vaccine was just a conversation about, we need a vaccine. That's what the conversation, we need a vaccine. And as you know, there was a whole political thing about how quickly it would come. And this happened very quickly. I think from what I understand that in a normal situation, there would have been more trials and more whatever, and it would not have been as quick, but it came around. We began to discuss the building of this infrastructure, sometime October or before then, when was it?
Yeah, it was September.
Yeah, the director says around September, we began to talk about building infrastructure, and we needed to understand what the mandates would be, how it would come down from the federal to the state government, how they were going to roll it out, and what would be the best way. So once we understood the directions that they were setting, then we began to put the meat on the bone, so to speak. But we've had the discussion back in terms of September, but the actual putting the meat on the bone and setting things up in order to make it operational, we did that pretty quickly, and we started that in late November. Anybody else?
Quite a few. Anna Huntsman with Idea Stream.
Mm-hmm.
Where can eligible city residents or agencies sign up to get the vaccine? And is there an online portal like the one Cuyahoga County has?
We do not have an online portal at this time. You're developing?
We're working on it. Yes.
Working on. And so we do not have an online portal. We are working on that. This whole thing around people signing up as to when they would get the vaccine, that is the direction that was given to us as to how they would like for us to deal with this next group coming, which is the 65 and above. And I think they're going to make that the first priority of that is 80 and above. So now that we know the direction, we will set up the portal, and so when those people become eligible, there's a way in which we can they can sign up, make appointments. But at the same time, we're working through our Department of Aging, and we're working in partnership with our senior high-rise buildings, whether they're public housing or private senior living facilities, to work with them to identify people who are in those facilities that fit the category, so that we can just have them bring people to a site and to get the vaccination, or we can go out there with the mobile unit. So we're doing it on two things, not just signing up, but also having those captive audience kind of buildings be able to identify people who fit the category priority and want the vaccine. And we will work with them to schedule them to bring the people to sites so that we can then give them the vaccine. So we're working on both ends.
Okay, and I have a couple more questions. Phase 1B starts on January 19th. Will the city be ready to vaccinate this next group by then? Or do you still have a lot of people left in 1A?
Well, the question is, January 19th is the 1B. Will we be ready to do this new group on the 19th, or do we still have a lot of people left in 1A? And the answer to both questions is yes. We still have a lot of people who are left in 1A for whatever reason, and we'll continue to work on that. And we have this new group coming on, 1B, and they've expedited that to make it, they pushed it up to next Monday or next Tuesday or something like that. And so we'll be doing it on both ends when that comes. Again, this is a factor of when we talk to the state health department and to the governor and lieutenant governor, they fully recognize that even though they expedited and said, well, these people become eligible, they fully recognize that even though they're eligible, that there is not enough supply to vaccine them. They fully recognize that. But that being said, they're saying to us on local community that this is the next group. We're going to expedite them, and we're going to bring them up and have them eligible on the 19th. And whatever you have, then we want you to be able to dispense to them. And once you use it up, and you have to wait for another supply. And that is why they want these portals set up. To your first question, these portals set up so I guess they can have a list of people who are eligible. And that's why what we're doing is we're going to have that as people can sign up, but we're also going to be working with these building owners to identify people and bring them to us so they don't have to sign up. And then we'll have mobile units, and we'll be working with our Department of Aging. Now, the real question comes in. This is the real question that I have, and it has not been completely resolved, that once 1B starts and you have this new group of people who are now eligible, then what happens when the vaccine runs out for the group that was designated for group 1A? Are they then as just it for them? That's the real issue. Because if that's the case, that means that on the 19th, if we receive vaccine for this new group 1B, and we then run out of vaccine that was designated for 1A, then what happens to those people who want the vaccine in 1A, but there's no more vaccine for them? Can you use 1B to give them vaccines, or are they just out for now until the supply meets the demand? That's the real question. And that's the question that we're asking as we are going. And I imagine the hospitals will ask the same questions, and pharmacies ask. That goes to that eligibility, and goes to, what happens if, because we don't have enough supply, and you run out and you got a new group, even though you don't have enough to vaccinate all this group, but you add another group and you give a designated amount to them, it's not enough for them either. So and they haven't been able to answer that question yet in terms of what we do.
And actually, that was Bob Higgs' question, so I think you answered it, but I'm gonna read it anyway. Bob Higgs asked, when would you expect to have the initial 6,500 doses administered? And will those only be administered to 1A patients? And how big is that 1A group?
The 6,500 doses, how long do we think that will last? Is it enough to cover the group? It won't last that long. Like I say, we'll be over 2,000 today. And by the time people come and get their second dosage and stuff like that, and we're ramping up our mobile units and we're identifying people, it'll go pretty quickly. How fast, I don't know, but it will be gone. And again, the real question is, to me, once it's gone for that group, and we have now identified another group, and they're sending us vaccine for this group, and the vaccines they send us for this group is nowhere near enough to handle that group, then the people who didn't get it in the first group are then, whether they left out, you can't give them the new vaccine, you know, what's going on. That's the real issue here. And that's the issue around not having enough supply to meet demand. And that is why the Trump and Biden administration have finally agreed on something, that getting all of the vaccine out is what they're looking at now, with the understanding that the pharmaceutical companies will be able to ramp up their production and distribution to government enough vaccines so that when the round 2 comes for getting vaccines, that there will be vaccines available. That's the real issue going on right now. And it's playing itself out on a local level. It's just playing itself out on a local level. On a federal level and a state level, you can set up the priorities, you can set up who's in the priority, you can set the timetable, you can set all of that. But the actual implementation, the execution of it happens on a local level. And so as the local level is beginning to push back at the state and federal level, the decision has been made, I guess, to just loosen up everything and just send all the vaccine out. What that means in terms of what we will get and whether or not it answers the question of us being able to have a broader group of people and have vaccine on demand as opposed to vaccine on priorities, we don't know yet. But we're waiting for all that to play itself out.
Dan DeRuse from WOIO asked, many reporters asked multiple questions, and he's waiting on an answer to how many people in the room with the mayor have received the vaccine, and how did they get into 1A?
No one received a vaccine in this room. Right now, it's 5 of us, and no one's received a vaccine, and we will receive, no one in the city of Cleveland who is not eligible has received the vaccine who works for the city of Cleveland. When you become eligible, then you will receive the vaccine.
Scott Knoll from Channel 5 asked, has the city had to dispose of any doses of the vaccines at this point because they either expired or were not administered in a timely fashion and were no longer kept at the appropriate temperature?
Did the city have to dispose of any vaccine because they were what?
Because they were either expired.
They were expired.
Or were not administered in a timely fashion.
And were not kept. And the answer to that question is no. Now, I heard that Friday that when we went out with our mobile unit, they had, you know how they take the syringe and they get the vaccine in the syringe, that they set a couple of them on the table and those syringes fell off the table. A couple of them, just two. And it didn't break or anything, but in precaution and just for safety purposes, they did not administer those two shots. There are two shots that were not administered, not because of anything that you mentioned. It's they put syringe on the table, it fell off the table, a couple of them, and as a result, they didn't break or anything, but they decided not to use them for precautionary purposes. Y'all busy today, boy. Y'all busy today. But you know, but let me tell you something. I don't mind. I don't mind because people want to know. People want to know, and they want to. My job is to bring clarity to this, as others are trying to create chaos and confusion for whatever their reasons are. Our job at the city is to bring clarity to this, and that's what we're into. So I don't mind it.
We're quite a few. I just want to make sure I didn't miss anybody. And we do have a couple questions that I will come back to that's not on subject, but we will ask them.
All right, go ahead. What do we got?
I just want to make sure I didn't miss anything. It's a lot of them. Okay. I just want to get all the one on the vaccine. Okay, so now we have a couple that are off topic.
So did you get all the vaccine
I
ones?
believe so.
So I'm being told that we've handled vaccine, now we're off topic, so I will address off topic as best I can.
I just want to make sure I didn't miss anybody.
But believe me, I'm not going to spend much time on off topic. If
Oh, okay.
What is it?
Darlene Carley asked, we have over 383,000 people that live in Cleveland. 6,000 doses isn't even going to put a dent into that. It was more of a statement.
It was a statement, not a question, which I agree with, that we have almost 400,000 people live in the city of Cleveland, so 6,500 doses is not going to put a dent into it, and that is absolutely correct. I completely agree with it. Now, but let me mention to the person who made the statement, that's 6,500 just with the city of Cleveland. You have the hospitals have theirs, and that's a number, that number I don't know, but it's more than ours. And then you have the pharmacies that have been handling those congregate living, like nursing homes and places like that, who signed up, and they're handling those, and that's some thousands also. So there is more than just the city of Cleveland who's doing the vaccination, but I agree with you that in total, even if you add up all of the organizations who are giving the vaccine, is woefully under what is needed. Even if you have half the people rejecting it, or 40% rejecting it, even if you have that, it's still far below what we really need.
Angela Sharpley says, Happy New Year, Mayor Jackson and City Hall from Piping Hot Grill at Glen Village.
Mm-hmm.
And Kevin Berry from Channel 5 has a question. The CDC and the HHS said earlier today that states should start vaccinating everyone over the age of 65,
right,
so that as much of the vaccine gets out as possible. Will the city change its vaccine approach based on that?
The question was, CDC said today that they want 65 and over, and so that they can get as many people vaccinated, particularly in that high risk group. I agree with that, by the way. Again, but let me go back to what is going on. If the supply to vaccinate 65 years and older is not there. So that is why and the question was, does CDC told the states that that's what they should do, but the states have discretion. So the state of Ohio is recognized as 65 and above and those with underlying illnesses. But because of the limited amount of vaccines that they have to distribute throughout the state to the hospitals, the health departments, the pharmacies, and all those other qualified agencies that will be given the vaccine, they know that they don't have enough. So what they're going to do is they're going to say 80 and above first. So even though the CDC said that and told the states you should do this, is exactly what I said before. When you get the federal government, they said, tell the states you should do this. And the states tell the local community you should do this. And so the state of Ohio has taken an approach that recognizes what the CDC has said about 65 and over and underlying ailments, but they're breaking it down into a smaller group because of the amount of vaccines that they will be receiving that will not be sufficient and to even do the small group that they're going to pull out of the 65 and over. So that is what's going on. So, and the final part of the question was, do we as a city plan to do something different than what the state has mandated? I would like to. There are some approaches to life that we believe that would be helpful for us in terms of getting the vaccine out quicker. But at the same time, I fully recognize that once we use that vaccine, then it comes to a stop. And there's no more vaccine until it's given to us by the state. And when the state gives it, then we can then begin to ramp up. So what we're doing is we're following the mandate of the state. And we're going to do the best we can to ensure, as the state mandates categories, that we're able to effectively and efficiently vaccine that category.
Okay, the next question is from Brian Duffy from WOIO. This is off topic. He asked about the security measures that may have been put in place regarding Inauguration Day, which is a week from tomorrow. There have been warnings from the FBI that there is a potential of violent protest across the country. Is the city prepared?
The question is, off topic, is there's inauguration, I'm paraphrasing, inauguration next week. FBI and others have said there's threats throughout the country, particularly in DC and state capitals. And since we have these warnings, is the city of Cleveland prepared? I can say to you that I've had this conversation with the safety department, and they are on top of it in terms of looking at the chatter that is going on and monitoring what they monitor as police and their intelligence and things like that. So they are developing a strategy and plans to address potential things that may happen on inauguration date, but also I would think that they're looking at doing some things even before then, since these things sometimes things are planned, sometimes things just pop up. So I'm pretty sure that they're working on, they're on top of it, and they probably will be planning on things even before the inauguration date.
Mariah Miles asks, when will people 80 be able to receive the vaccine, and how can they sign up?
Question is, how will people 80 years old and above be able to receive the vaccine? How do they sign up? I'll let the director answer. I think the governor is going to make that announcement today about when, and then it goes to the earlier question about a portal for signing up, and then it also goes to our approach is to work with senior buildings and our Department of Aging to identify people and then have in some kind of way them transported to a vaccination site. But Director, you have anything on this?
I think you summarized it pretty good, Mayor. But we will work with our Department of Aging to communicate out. They're excellent in communicating out to the senior population. So we're going to rely on that strength that we have internally to make sure that everyone is aware how to sign up and when to sign up. So we haven't forgot you. We will make every effort we can to ensure that the communication is clear to that population.
And so that you know, there is there. I want everyone to understand, it's not just the city of Cleveland who will be dispensing the vaccine in this second phase, just like it's not just city of Cleveland in its first phase. So in the second phase, you will have the hospitals, the pharmacies, the qualified health clinics, all of those entities will be able to dispense the vaccine in addition to the city of Cleveland. So the question is, how are people able to identify where to go and which one is the most convenient for them, and how do they sign up depending on which one they choose. So it's having that variety of choice. And I know that the hospitals and us, we're working on how do we communicate that so that people know who do you call, where do you go on what website, and then if we're able to talk to building owners about people who live in their facilities who are 80 and above and work with them on bringing them somewhere, then we'll do that too. But it's not just City of Cleveland. It's all of these various entities who have the authority to administer the vaccine.
We're coming to the end here. Scott Knoll from News 5, is the main part in the unrest at the U.S. Capitol last week? And if so, what is your reaction to that?
The question is, do I have aware of anybody, a city employee, who took part in the stuff that happened in the Capitol last week? First of all, no, I'm not aware of anybody. But let me just point out to you, even though you didn't ask it, but let me just point out to you that everyone has a First Amendment right to demonstrate, which is the same thing we say here. What you don't have a right to is to tear stuff up and to harm people. And so I'm not aware of any city employee who was involved in either their First Amendment right of demonstration or their non-First Amendment actions of tearing up property and harming people. Neither one of them are we aware of at this time. If we are, then I will, if we come to our attention, then we will assess if they're a city employee as to which category they fall into. Were they exercising their constitutional right and just demonstrating and voicing their opinion, or were they engaged in illegal activity of destruction of property and harming people? And if we find out, we'll act appropriately depending on which category they're in.
Just make sure. I think that may be it.
Well,
oh, someone asked a question.
We got one more.
Jason Walker asked, can you still transmit COVID-19 even after receiving the vaccine?
The question is, can you transmit COVID after receiving the vaccine? I'll let the director answer. It's my understanding that the vaccine does not prevent transmission. The vaccine prevents and mitigates how sick you get. So if you get the vaccine, then you can still catch the virus, but it's supposed to mitigate how sick you get, so you don't get as sick, or it helps to increase your odds of not dying if you're in a high risk category. And I think the same thing happens on the transmittal side, that if you have it, you still, still the mask, right? And still social washing your hands. It's just like flu. You can have the flu and give it, even if you got the flu shot. But I imagine, Director,
That was accurate.
right, so they're saying, yes, you probably could, you could transmit it. But if people had the vaccine, then it mitigates the symptoms and the severity of their illness to the point that they're not as sick and they can recover quicker. Again, just like the flu, you get the vaccine, flu vaccine, but you catch, when if you do get it, then it's mild compared to severe. And then, but you still can give it, even though you had the vaccine. That's my understanding.
And Jason's follow-up is, God bless y'all. So sorry that you have to consider these questions, and may your decisions be blessed.
Well, I tell him I thank him very much for that. Again, I appreciate you tuning in, and again, we will update as we go, and as we are, if we're and we'll learn as we go, as we're building out our infrastructure, and we'll measure ourselves, and we'll see if we're efficient and effective in doing what we're doing. We'll work with our local partners or hospitals or clinics, pharmacies and things like that to particularly on the next phase, and particularly since there will not be anywhere near sufficient amount of vaccine, and how do we effectively communicate and efficiently get that vaccine out and give people confidence that there will be more vaccine